So knee pain, correct?
Correct.
All right, and you have pain on the inside of the knee.
Mhm.
And this has been going on for, I assume,
Couple
how long?
years on and off, just from dancing, hiking, exercising, just a lot of weight bearing, loading.
Okay, so when you exercise, you weight bear for a while, then you get pain on the inside of the knee, is that what's
Correct.
happening? Okay, so, and if you had any steroid injections to the knee in the
No.
past? Okay. What we're gonna do is, we're gonna use a regenerative technique today called Prolozone. So this is outside of standard injections, which usually mean that we're gonna inject a cortisone. That can take away pain, but it often causes joint degeneration. Steroids intra-articularly can cause degeneration of cartilage, they're chondrotoxic. But however, this is going to be a regenerative injection. So what we're going to do here is we're going to put in a nutrient solution. This contains minerals and nutrients, and then we're going to follow up with highly energized oxygen. When tissues are deprived of oxygen, that's when you develop pain, but secondarily, they don't heal. So what we're going to do is we're going to give you some nutrition to the joint, then we're going to follow with ozone to induce a healing response, which will also reduce your pain. So to do this, what we're going to do is we're going to find an area to inject, and because you have medial knee pain, I'm going to go to the medial side, inside the knee, and we're going to find an area, we're just going to mark this up, and the next we're going to do, we're going to clean it with Chloracep. I'm just going to clean this area. And then from there, we're going to do an injection, but I'll use some cold spray on you so you don't feel the needle so much. And you're going to feel like a little pinch, 1, 2, 3, and pinch. And then I'm going to follow the, okay, you okay there?
Mhm.
All right. Now we're going to inject. That's going in pretty smoothly. All good?
Mhm.
Now this also contains an anesthetic which will help out also. Now once that's done, we're going to be taking this off. Now we're going to introduce ozone into the joint. Now as this goes in, you're probably not going to feel anything at first, but then you start to feel a little pressure. And then as the gas expands in the joint, you may feel a little bit of achiness. So tell me when you first start to feel a little pressure.
Starting to feel it now.
A little pressure, okay. I'm rubbing your knee here just kind of distract you as I'm pushing this in. How you doing?
Doing good.
Okay, I'm going to go a little bit heavier now. So for a knee injection, typically we put anywhere from like 15 to 30 cc's into a knee. I think with you we'll probably go a little bit above 15 cc's of ozone. Again, that ozone is highly energized oxygen, and this will induce a healing response. I'm just going to hold that there. How you doing?
Doing good.
Okay, I'm going to take a 2x2. Just going to hold that there, and then we'll withdraw. And that's the whole procedure.
Now, how often do you think I should get Prolozone?
Typically, we're going to do a series of 3, but we may go up to 6 injections. Everybody's different. Typically, the injections will build on each other, so that usually with the first injection, you'll have some response. Some people do really, really well. They can have a tremendous response after even 1 injection. But then when you do a series, you're going to keep on inducing that healing response, so that hopefully by the end of either 3 or possibly up to 6 injections, your healing response would be very, very high. And then some people, they don't need another injection. Some people may come in for, say, a booster injection every so often, Could be anywhere from, say, 3 months, 4 months, 6 months, or even yearly, or perhaps not at all, depending on their response. Okay, how's that feel?
Feels good.
Okay.
Do you think I can just do my normal activities today?
Well, today I would have you not do too much today. I wouldn't have you do too much tomorrow. And also, because this is creating a little bit of inflammation, so understand this: inflammatory changes produce healing responses. This is the problem when people take non-steroidal anti-inflammatories for joint pain. It blocks the inflammation, but by blocking inflammation, you actually block the healing response. So I would say for today and for tomorrow, certainly you want to avoid things like ibuprofen, non-steroidal anti-inflammatories. I would even like you to avoid antioxidants because we want to create some oxidation here. So we don't want you taking antioxidants like vitamin C, E, things like curcumin for at least 2 days. And I don't want you really exercising them for a couple days. And avoid excessive heat and ice on it. But after 2 days, you can go back to your regular vitamin routine, and certainly you start up exercising in about 2 days or so. Okay?
Is this pretty effective?
Very, very effective and very, very safe. They've done studies where they've shown that cartilage can actually be regenerated with the use of ozone. Again, this is a regenerative technique. So while it will take away pain, which is the main objective here, the larger objective is to create tissue regeneration. That's the purpose of utilizing highly energized oxygen, which ozone is. O3 is actually, that's what ozone is. Ozone is actually, we breathe O2, but ozone, because the O2 gets electrified, like in a lightning strike, it becomes this highly energized molecule called ozone, which is actually O3. And once we put that ozone to the joint, it actually increases something called NAD, which is food for the cell and cell functions. So that creates the healing response. So it allows for tissue regeneration. Because when tissues are hypoxic, meaning they don't have enough oxygen, they can't regenerate. So when we put oxygen into the tissues directly, then we're creating a direct healing response.
And what else is this good for?
Oh, any type of degenerative condition. So we can inject any joint in the body. So we can do hips, we can do knees, I can do ankles, shoulders, elbows. I've done wrists. We can do spinal conditions, so neck, mid, and low back. TMJ. I've done ozone at the suboccipital region for occipital headaches. We've done that. And I've even done ozone at the coccyx, because there is a joint where the coccyx hooks up to the sacrum. So we can do any joint, and we can do this pretty much to anybody at any age. I've injected young athletes that have been hurt, and I've injected patients well into their 90s. And there's no real contraindication with this. We can use ozone even if somebody has had certain joint replacements. Ozone can still be incorporated into as an injection technique for people who've had some hip replacements possibly and are still experiencing maybe some post-operative pain. Sometimes we've done conditions like that. But we can do soft tissues. I've done certain athletes that have had groin pulls where we injected the insertion of the muscle onto what we call the pubis, where the groin is. I've done injections there. And we've done carpal tunnel, tarsal tunnel, and then we've done rotator cuff tears and so on and so forth. So pretty much anywhere in the body we can incorporate ozone.
Can you tell me about the pain I have in my foot?
Well, if it's on the bottom of the foot, like a plantar fasciitis, we can certainly do that. And also we can do the ankle. There's an area on the outside of the ankle where we commonly inject. But I've also done some of the long tendons that run down into the foot. So certainly we can do the foot. Bursitis we can do, any type of bursitis condition we can treat. Certainly tendinous conditions. Most common would be, that comes to mind, would be in the shoulder where people have rotator cuff tears or possibly strains, and those can certainly be addressed utilizing Prolozone. So what's unique about this type of injection is that in most standard injections they use steroids to inject into joints, which is good. It can take away pain. But the side effects of it is that it is chondrotoxic and can be injurious to tissue in the long run. And some people want to know, why can I come back next week and get another steroid injection? They usually say no. They should say no. Because typically if you get too many steroid injections, it does create degeneration of the cartilage and the tissue surrounding that joint. So By using ozone, what we're doing is this is a purely regenerative technique, and it's not reliant on heavy doses of steroid as part of the treatment. What we're doing, we're putting in nutrients and minerals as well as ozone gas to induce a healing response and a regenerative response. That's the main difference. This is a regenerative injection that can take away pain, as opposed to a technique that may take away pain but may actually have harmful effects on the tissues in the long run. And that's the reason why we do this type of technique.